Okay, so we know that with a lot of our neurological conditions and a lot of our autoimmune conditions, the source is chronic inflammation that is the cause. The bigger question is, though, where is this chronic inflammation coming from? And I'll take you on a journey that I'm going to show you this chronic inflammation is coming from the GI tract and dysfunction of the mitochondria. Some of the conditions that we know are related to chronic inflammation: bipolar disorder, multiple sclerosis, Parkinson's disease, depression, autism, chronic fatigue syndrome. Also, rheumatoid arthritis, ankylosing spondylitis, Crohn's disease, and ulcerative colitis. Chronic inflammation, we have elevated pro-inflammatory cytokines, whether that's interleukin-1 beta, interleukin-6, or tumor necrosis factor alpha. We also see a decrease in our anti-inflammatory cytokines, interleukin-10 and transforming growth factor beta. Time and time again, studies are showing an increase in those pro-inflammatory cytokines and a decrease in the anti-inflammatory cytokines. So causes of inflammation: mitochondrial dysfunction and your gut bacteria, the pathogenic bacteria in our gut. This is what is causing this chronic inflammation. Why mitochondrial dysfunction? Well, if we start at the level of the mitochondria, we know this is our source of ATP. That is our energy source. That's the energy source for every single cell. Study after study is showing, though, when we have mitochondrial dysfunction, this causes reactive oxygen species, and that's leading to chronic inflammation. You can see right there CoQ10, part of the electron transport chain. When we get deficiencies in CoQ10, such as when someone's on a statin, this reduces levels of CoQ10. That can lead to mitochondrial dysfunction. And oxidative phosphorylation in the mitochondrial electron transport chain and oxidative phosphorylation, free radicals, they're just naturally generated. The thing is, do we have enough antioxidants to combat those free radicals and that oxidative stress? What happens is, if we have the mitochondrial dysfunction, that leads to the chronic inflammation, that creates more reactive oxygen species, and that leads to a constant cycle of chronic inflammation and more tissue damage.